Support for this work was provided by the New York State Health Foundation and Care Compass Network.
Thank you for joining us. My name is Jack Salo. In this video, you will hear from Derrik Chrisler, Vice President of Administration with Human Service Development. Human Service Development is a nonprofit organization in the Southern Tier, which grew out of a rural health network and is now a founding member of a community-based independent practice association, or IPA. IPAs and similar arrangements exist to organize community organizations and healthcare providers into a single entity or corporation for the purpose of value-based payment contracting. There are different models that are designed to achieve this same outcome. In addition to IPAs, you may hear the terms accountable care organizations, or ACOs, behavioral healthcare collaboratives, hubs, and others. The key thing to know is that these collaborative models are forming and are increasingly including a variety of both social and clinical services. IPAs and similar models can be an opportunity for your organization to become a VBP partner. Even if you are a relatively small organization, your services may be of interest to an IPA if they align with the focus and need the IPA is serving.
I think it's very critical that regardless of your size, you align with some other entity that provides similar services that can complement your own services. And that's what we're trying to do. We're developing relationships with healthcare organizations. We're embedding our staff in the ED. That didn't happen overnight. It took years for me to get and build those relationships with critical healthcare administrators to say, this is the service we provide, this is why it's valuable, and here's the evidence as to why we need to do this. Do you have to participate in an IPA? Do you have to be a contributing member? It's more along the lines of, do you have the relationships built or started with key members of a larger goal? And that could be an IPA, it could be an accountable care organization, an ACO, it could be a number of different entities that are developing across the state. We engaged with lawyers, consultants, experts in the field to kind of say, what do we need? And through that process, we identified we needed funding, we needed bylaws, we needed a structure to guide the membership outside of the bylaws component. So we started to write grants. So HSD, Andrea and I started to write grants to get funding for FLIPA. We also wrote several position papers and submitted those to FLIPS, saying, listen, this is what we need. These are the lives that this organization covers. This is where we need to go, and this is the funding required to get us there. We were successful in securing a number of grants. We went through the process. It took about 1.5 years to develop the IPA, meeting on a pretty regular basis, I would say monthly at minimum, sometimes more. So the biggest benefit of a CBO, community-based organization, joining an IPA, I think is collective impact. And what I mean by that is, I mentioned it a little bit earlier, with the FQHCs, and the substance use treatment providers and the community-based organizations coming together to form an entity that addresses all aspects of care, we really have a product, so to speak, that says, if you contract with us, and by you I mean the MCOs, the managed care organizations, if you contract with us, we can provide care for this individual from the beginning to the end, and we can address all of their needs in one single contract. A lot of the healthcare systems are looking at how to provide these additional services, and I say additional because they haven't done it in the past, but community-based organizations have been doing it for a long time, and they're saying, okay, well, let's go ahead and try this. And they're not doing that well in it because they haven't done it. They don't have the experience. And it's costing more because they're having to pay these the staff at the traditional clinical wage. So community-based organizations have a good fit because we provide the services, we're better at knowing the key organizations that provide the services in our area, and we do it in a more cost-effective way. I think that it's critical for community-based organizations to start those conversations now rather than waiting for the IPAs to be formed, because if you wait, you won't have as much power, so to speak. You won't have as much rights or participation at the board level where the decisions are being made about how funds are shared and the value of the services provided by those organizations. Research, I cannot stress that enough. Research about what an IPA is, what the structures of IPAs are. Look in other states, because this isn't a new idea to New York State. These entities have been forming all across the region and probably in other parts of the world. I haven't gotten that far, but research. Looking at what's already in existence, what are the barriers, what are the successes, what are the models, because there's tons of different models of IPAs as well. Just because you speak English doesn't mean you can speak healthcare. Be willing to try new things and implement new strategies, because what your traditional model was might not work anymore, and you might need to be able to change. And I know a lot of people think change is scary, but I think change is exciting. And I think the ability to create new and innovative ways to approach challenges is what gets me out of bed every morning.
Support for this work was provided by the New York State Health Foundation and Care Compass Network.